Acute care in the Netherlands will be facing a number of challenges in the coming years. By 2040, the population will grow by 1.3 million people, and the number of elderly will double. But doctors are already having trouble finding enough time for their patients right now. Waiting times at urgent care and emergency rooms are long, and in many regions, ambulance response times are getting longer. Meanwhile, hospitals are becoming more specialized, concentrating specializations at specific locations and reducing their treatment times. All this is increasing the pressure on community healthcare workers and home caregivers in a sector that was already facing capacity shortages and a difficult labor market. Patients are having a harder and harder time navigating this system. They run around from office to office or are transported over greater distances. At the same time, as the population gets older, their care needs are becoming more complex and more urgent. A complicating factor is that elderly people are living at home longer. So who do patients call, and when, and for what? What both patients and care providers need is a single contact point for all acute care issues. One coordination center in each region, making sure that patients get the care they need as fast as possible, from the right care provider, at the right time, and at the right location. One point of contact, giving the care providers real-time information about the patients and available capacity so they can focus on offering quality care. Regional care coordination can be a reality if providers of acute care like mental health centers, general practitioners, urgent care facilities, ambulance care, hospitals, home caregivers, and midwives come together in a single point. This could be done if they take 5 important steps. First, single access point. There will be a central app for the acute care domain. This will exist alongside the familiar emergency number 112 for immediate, life-threatening situations. Second, triage protocol. The cooperating acute care providers will develop a joint triage protocol so all care providers can be assessing and treating in the same way. Third, right deployment of care. Professionals with chain-wide expertise determine the right care to deploy. This can lead to direct contact between caregiver and patient, self-care recommendations, or transfer to scheduled care. Fourth, management of follow-up care. The Care Coordination Center will continue to manage the care process after the initial care until proper follow-up care is happening, at which point control passes to the other care providers or the patient. Fifth, self-management. The Care Coordination Center supports self-management of patients by providing information, recommendations, and technology, so care providers only have to undertake action when genuinely necessary. Essential to all these steps is that the Care Coordination Center has access to all relevant and current information about the chain expertise and patients at a single point. If the urgent care providers take control, by the year 2025, we can have regional care coordination centers functioning effectively across the entire country. There are currently no more legislative barriers to making regional care coordination centers a reality. And as the mobile link between all parties, Ambulancezorg Nederland would like to hear from other acute care providers about their own visions of the Regional Care Coordination Center. Regional Care Coordination. Let's make it a center of attention.